We're going to make sure that we review the numbers, and if it's a huge spike, everything's on the table. I will listen to our health experts, but the reason we're doing this, we want to avoid shutting down the economy as long as we possibly can, because I think that'd be extremely, extremely difficult on a tremendous amount of people.
As new COVID-19 cases continue to rise in Ontario, a group of 38 doctors is calling for action. They say restrictions should be imposed on places where people are gathering to socialize, like restaurants, bars, gyms, and theaters. Premier Doug Ford, as you heard there, is reluctant to do so, but 4 provinces, including Ontario, the Prime Minister says, are now in a second wave, and federal modeling suggests it could be far worse than the first. To dig further into all of that, I'm joined now by one of those doctors calling for tighter restrictions, Dr. Alison McGeer. She's an infectious disease physician and director of infection control at Mount Sinai Hospital. She's with us from Toronto. Hi, doctor. Good to see you again. Thank you for making time for us.
Pleasure to talk to you.
The group of doctors you're calling for tighter restrictions in response to these numbers and what may be to come. Could you explain for our audience what some of those restrictions might look like?
So, at issue here is that because we have reopened, because we have started schools back, we've moved into a time when we have enough contacts that the virus is spreading again. And when the virus starts to spread, it's not a linear thing where things go up by 5 cases today and 5 cases tomorrow and 5 cases the next day. It amplifies itself. So it starts with 5 cases today, and then those 5 cases transmit to other cases. And so you get what's called an exponential increase in the number of cases. And added to that, one of the real difficulties with looking at COVID is that there's a fairly long period of time from one case to the next. It's at least a week or 10 days from the start in one case to the start in the next case. And that means that what we're looking at now in the increase in cases is a result of our behavior 2 or 3 or even 4 weeks ago. And so whatever has happened between 3 weeks ago and now, that's fixed, and those cases are going to go up. So we're going to see a continuing increase in the number of cases, and an increase in the increased number of cases over the next 3 weeks. What we do now determines what happens a month from now. And that means that all of us need to have less contact with other people. And I think we probably don't want to make that happen by shutting down schools. We want to make that happen by people being willing to give up things that they might be willing to consider are non-essential for the next month. It's not a forever thing, okay? It's going to be coming and going with the pandemic. And so, and where we're having difficulty now is in big social events. And we know now from American data that eating indoors in restaurants is a significant risk factor for COVID-19. So I think what I'm hoping is that whether from public health instructions or from restrictions or just from all of us responding to this virus to make things better from everybody, that we can all reduce our number of daily contacts again, and get back to something that's a little closer to August. Okay, we're not aiming for March. Nobody wants to shut down. But if we don't move now to reduce our contacts with other people, then we may well be facing a lockdown at the end of October and November, and that's something we all want to avoid.
You've explained the timing more clearly than anything I've ever heard. I just want to make sure that we sort of double down on that for a second, because, for example, when the province announced about a week ago that they were restricting further the number of people who could gather indoors and outdoors, we won't see if there's an effect to that by what you're saying for a number of weeks. Is that correct?
At least 2 weeks, and it looks like a little bit longer than that before you see the effect. Yeah.
And when you say
it's one of the things that's really hard about this virus.
Yeah,
there's this lag time between what you do and what you get in cases. And it's just one more difficult thing about the pandemic. This is not easy for anybody.
We were just speaking right before you to two restaurant owners who are already, have just had a terrible 6 months trying to get, trying to be as resourceful as possible to get through this. One of the points they raise, and this is obviously different from the health discussion, they need very certain aids and supports from the government in order to, if this does happen, for example, try and make it through it. They were asking, though, or they were making the point that the data is not incredibly transparent in Ontario right now. Like, we know that we're told by public health officials and politicians that a lot of it comes from gatherings, from social gatherings, backyard parties, barbecues, that kind of thing. We know that there have been cases, for example, on flights that have landed. But beyond that, at least the general public doesn't have an exact sense of where everything is coming from. Do you think that we should?
So, should is a lovely term. There are many things we should have that we can't have. Okay. But
fair point.
No, so the answer to me is no. I don't. What all of us need to know, and what I think we know, is that the more close contacts you have every day, the more people you come into contact with, the greater the risk of transmission of the virus. Doesn't matter who you are, doesn't matter what you're doing. The closer you are to somebody, and the more time you spend, and the more time you spend close to somebody without a mask, the greater the risk is. And of course, this is differentially unfair, right? When we say eating indoors is a risk, and we know it is from the science, and people stop going out to dinner, that is really hard on restaurants. And I'm sure many restaurants have probably already gone out of business, and all of the rest of them are suffering badly. The way to fix that is not to say it's okay, we'll just let more people die from COVID.
Right.
The way to fix that, as those restaurant owners will have pointed out, is we need to help them to get through the pandemic so that they can come out the other side and still have a business and still have us go out to dinner. But if we don't do those restrictions, if the number of cases go up, they're still going to be out of business. They're just going to be out of business a month later. And that's not helping anybody. The start of managing the economy is controlling COVID. Everything after that is really difficult. But if we don't control COVID, then we also don't have an economy.
I thought what you said also about this isn't forever, right? I think in that's kind of lost in the discussion right now, because everyone is very focused on whether or not there's going to be a big shutdown or whether or not they're going to close certain things. But if they did take more restrictive measures right now, it's your sense that it wouldn't be for the next 6 months per se, but the next month, at least at this point.
Well, yeah, it is really hard. We're trying to run this balancing act of how much we can have open, how much contact we can have, and still have control over the number of cases of COVID. And we knew when we went into the fall that as we opened schools, as we allowed people to get back to normal, that we were taking a risk that we would have too much contact and the number of cases would start to rise again. And we knew that when that happened, we were going to have to do something about it. The goal is to try to do something about it early enough so that it's not a major lockdown, and so that we don't get into the situation where we have dreadful long-term care outbreaks, and we have hospitals that are overcrowded, and we're canceling surgery again, right? So but this is very much a balancing act. The goal is, okay, let's reduce our contact by a certain amount now, get control over it again, and then we can then take a look at it, and maybe we can walk a bunch of those things back again, and we'll just kind of try to hit the balance of saying, what is it that we can do together to make sure that we're keeping control of COVID transmission while minimizing the impact on all the other aspects of our life.
Gotcha. Well, thanks for such a clear explanation. I appreciate you spending some time with us this evening. Thanks, Dr. McGeer.
Pleasure to talk to you. Take care.
Dr.
Stay
Allison,
safe.
You as well. Dr. Allison McGeer is an infectious disease physician and director of infection control at Mount Sinai Hospital. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.